In December of 2019, Vivienne became very sick. After just a quick visit to the ER, we were rushed to ICU, and that's where she received treatment, and then just dove right into the whole new world of type 1 diabetes.
I was still pretty young, and it's a lot for a child to have to understand. You got diagnosed with this, and now everything you do in your day-to-day life is about to change.
Her care became quite complex, and I resigned from my job. At the time, we were on a commercial plan. Shortly after that, I had gone through a divorce, and then we lost our health insurance coverage. That is what led us to her, needing to get on the STAR plan, and I'm just so grateful. I never worry that Vivienne's needs aren't going to be met.
Medicaid as a federal health insurance program has been around since the mid-60s. In the late 90s, Texas decided that they would use managed care companies to provide the services. And so Cook Children's Health Plan was formed. We're different than the other plans. We may have some of the same providers in our network, but we actually care about our members. We live in the same community as our members. We know the resources in our community. We're much better situated to access some of those other services that they may need. Families with kids who have difficult health conditions want to choose our plan because they know that we provide better care. This is unbelievable that they will no longer have the choice of Cook Children's as a health plan for their Medicaid or CHIP.
Families have a trust with us because we're connected to the Cook Children's healthcare system, and that connection and trust allows them, to work with us and help them to navigate the healthcare system to get services that they need. Losing access to primary care doctors, specialists, maybe equipment that they have at home, supplies that they get, therapies, mental health care providers. Sometimes things require an authorization process. There's a lot of paperwork involved. That process would have to start over again. Our health plan has nurses, social workers, support staff that know this community and are familiar with the resources and programs available to them and connect them with those things. Vivienne is followed in the complex care program, and they've been with Cook Children's Health Plan themselves for a long time, and having to start that process over with somebody new is just adding more stress to their life.
I think that it would just be terrible. I mean, I really have no other words for it. Insulin is so costly and so expensive. Who can just drop $2,000 every 90 days for one medication?
I'm not even paying for it. I just go, and it's a lot for me.
Sorry. Vivienne is so resilient, and she's faced so much. She should never, ever have to worry. To feel that pressure or that responsibility is just, it's not hers to bear.
It's not right. It's not what we need to be doing for these families. We need to make it easy for them to get the care that they need. Across the state, 1.8 million people will have to pick a new health plan. Our current contract goes through August 31st of next year. The state still has time to fix this incorrect decision. Families love Cook Children's Health Plan. They actively choose Cook Children's Health Plan. There's no reason they shouldn't continue to have Cook Children's Health Plan as an option for their coverage. You've got local nonprofit plan embedded in the community alongside a national for-profit plan. You can make the choice. I'm happy to compete all day long with whoever, is in my service area, but offer a meaningful choice of plans. This is not about money for the system. This is a fight for the children in our community to be sure that they still have access to the high quality care that we provide.